when should you be choosing the safe harbor method, and when should you go over the expert determination? Is there a difference there?
There is. I mean, obviously, expert determination requires a lot more analysis. And, when the data set changes, like if you start to capture extra information or you want to send something different, you have to go back and re-examine that.
Okay.
So it is a little bit more work to maintain there, which isn't to say that safe harbor is no work. There's still work involved there, but it's a little bit, I guess I would call it a little bit faster and easier to implement.
Okay.
Right? Because there are tools you can get off the shelf that help you do this sort of thing, and you just go in and you change all the data, right? And you're changing all the locations where the names are and the addresses are, and you lose 18, then you're considered safe. So
Got it.
You can go and do that. It's a straightforward approach. If you've got a lot of databases, you're a big organization, you've got 100 databases. Do you want to have 10 experts sitting around for 2 weeks to verify a data set?
Right.
They kind of make that judgment call. If you need to share data out, then that kind of leans more towards expert determination method, because you're sharing it and you want to get it back and maybe get some results and look at the analysis. That's a little different.
You're right.
But if you're just talking about pure like development testing and you're not as worried about the data utility, then safe harbors.
Okay.
Faster, easier, faster implementation.
Okay.
I'd say easier because it's always difficult.
Gotcha. It's kind of the quick button for obfuscation there.
Right.
Interesting. Okay. That makes sense. So what do you think are the advantages to expert determination as opposed to safe harbor, outside of, the simplified use that comes out of safe harbor?
The advantages of expert determination, I would say, because you're not changing data, you don't lose any of the richness or the utility of it, right? And what I mean by that is, if you're going to go in and you're going to change addresses and you have to change zip code a specific way, then you're going to have probably a little bit of what I would call blurring in of the kind of clear geographic zones in which you're doing, in which the data sits. And so for customers that are doing something regionally, or, if they have some specific kind of logic around the zip code. And, example was we had a healthcare client that wanted to make sure that the mass data all needed to be clinics within a 1.5 mile radius of the patient's original address. When you're changing the address, now you have to change all the clinics.
Right.
Attending.
Yeah.
That gets very complicated to do with the safe harbor method. Right. But if you can go and remove all the pieces that allow you to identify who that data belongs to, then you can leave those zip codes and the addresses. I mean, address probably not, because you can look them up in the phone book,
right,
property records, et cetera, but the zip code at least, right, doesn't need to change if there's nothing else to go along with it that would identify the person.
Got it.
Does that make sense?
Yeah,
so,
that makes perfect sense.
In terms of data utility, expert determination, it gives you maximum data utility, but it does take effort to get the data set to that point where it's safe.
Okay. I think I'm picking up what you're putting down. That definitely makes a lot of sense.
It essentially just depends on how you want to utilize that data once it's being masked, right?
Right. Cool. I mean, expert determination is not really, I don't want to say it's a bad idea for development and testing. It's just an expensive idea for development and testing. Unless it's if your data set contains 2 columns or 3, a half a dozen fields and none of them are PHI, that's probably easy.
Yeah.
It's not PHI.
Yeah.
There's no PHI identifiers in it at all.
Okay.
Then maybe that's easier, right? But in development and testing, where you're going to have lots of databases, we have some healthcare customers with billions of rows of data. How are you going to pour through that statistically, right? As an expert, and make sure that all those records are safe.
Right.
I mean, you're not going to share 1 billion rows of data either.
Yeah.
But you see my point. It does get more costly. I don't remember who it was which one of you guys asked about the AI though.
I think it's Jan.
So yeah, and you asked about AI, whether AI could be the expert.
Correct.
Potentially, yes. But you still need an expert to train the AI.
Right.
Tell it, here's all the relationships, right, in the data. Although there are some, there are some groups that are looking at, at least in healthcare, they're looking at, can the AI find patterns that we don't see, right? So, there may be a path forward there, but I don't believe that there's any AI out there right now that can do that.
Okay.
But if it was implemented,
Training it, they could be training it right now. I don't know what
Yeah, of
all the
course.
experts are up to.
yeah, and that could definitely help out with billions of lines that you would have to go through.
Sure.
Absolutely. It would definitely streamline the process at least.
It would, yeah.
Yeah.
You definitely need to. I mean, you would need to train the AI, given enough. I mean, billions of records is enough.
Right.
But yeah, there could be some that are. I don't know of any right now, but I'm sure that somebody's looking at that.
Yeah. I mean, it's just a lot of data for them to comb through in order to get to that point. So that
But
makes
then you have the other problem. Now you're putting all this unprotected PHI
right.
into an AI,
Correct.
right? So are you running that internally?
Right.
You're not sending it to ChatGPT.
Yeah.
These other, common AIs that are out there.
You would hope not.
Public,
Yeah.
right? I mean, there might be some, but you wouldn't want them. You wouldn't want your protected health information being fed into one of these generative AI models, or even the DeepSeek or whatever.
Right.
They are.
Right.
So there's that concern as well.
Okay. That's perfect. That actually brings us to the next topic, which is interesting, which is just the challenges in managing the development and test data. Why is it important to minimize the use of PHI in development and testing?
Well, the obvious things are, besides just violations of HIPAA, breaches, right?
Right.
Breaches are
Common.
not good.
Yeah.
They're common. It seems like you see them in the news all the time.
Right.
But what happens when we see a breach, right? I think in some countries, there are much more stringent kind of rules,
Right.
and penalties around that sort of thing. I mean, it's starting to happen here too. But you see it. There's breaches. It's like every other week I get a letter that says that my data was shared or somehow somebody accessed it.
That was my bad. I'm sorry about that.
And
We got you on this
they-
podcast.
they pay for LifeLock or whatever that credit monitoring services, and you basically they just monitor your credit for a couple of years, right?
Right.
And breaches are bad because there could be penalties. There could be litigation, right? And the worst is the reputational damage,
Of course.
right? I mean,
Yeah.
if you've got a reputation of being a company that's been breached multiple times, that's not a good look, right? Hire a PR firm.
Of course. Yeah.
Okay.
Understand it.
So would de-identification be the only way to kind of mask the data? Are there other?
No, there are some. There's pseudonymization.
Okay.
I think I pronounced that right.
Yeah.
So like a
It's
pseudonym?
a very long. I always use tokenization.
Okay.
That's really what it is. Right?
It's just, that rolls off the tongue a lot easier. Yeah.
Right. So essentially, what it is you're going to replace the sensitive data with some sort of a token.
Okay.
That token can be an alphanumeric string. It can be just a number. Depending on how you want to tokenize that data. And there's tokenization solutions out there that use different kind of combinations of those. But essentially, what it is it just replaces the actual data with something else. So instead of seeing George Barroso, you see 1, 2, 3, and 4, 5, 6.
Okay.
Right.
To use a dumb example.
But I can see that being implemented in the healthcare industry pretty easily with tokenization.
Yeah. So in tokenization specifically for healthcare is used. It's very common. I see a lot of our clients use it when they need to share data with third parties.
Got it.
And they need to reverse it back. And I know we talked about expert determination being able to do that.
Right.
And I kind of introduced it a little bit, but essentially, all of our healthcare clients that are sharing data out to third parties are generally, instead of doing a masking or a de-identification, which many times in many tools it's one way because you don't want to be able to reverse it.
Right.
They'll use tokens instead and say, okay, instead of George, it's going to be 1, 2, 3. Instead of Barroso, it's 4, 5, 6. They're going to send it out. Whoever they're sending it out, whoever gets it presumably doesn't need the name to do whatever analysis they're going to do. Then they send it back. And then when the healthcare company gets it back, they just take the tokens and reverse it back to the name. And now they've got the analyzed data.
Oh, wow.
Right.
That's cool.
So
That's really
that's one of the other ways that we've seen healthcare protect the data while it's being shared out. And because it's a token that's arbitrarily assigned, there's no risk of identification.
Right. Right.
Gotcha. So essentially, it's like synthetic data.
I wouldn't. No, I think synthetic data is a little different. So synthetic data does not have an actual real value as the basis.
Okay.
When you're talking about a synthetic data solution, what you're talking about is, I want to go, I know I have this medical database with got medical record numbers, patient IDs, various other, PHI. I have nothing. It's empty. And I want to populate it with data that looks real.
Gotcha.
That's
Gotcha. Okay.
right. And there are companies and tools that do specifically that.
Okay.
Right. They generally don't do masking, although I think some of them are starting to kind of delve into that. But typically when you are looking to synthesize data, you're not necessarily doing it from a set of production data. You're just generating,
creating something.
right?
So it's totally random. It's not it for the most part.
Right. I mean, that's a challenge also, because with synthetic data, the challenge there is there are relationships between all of these different tables
Right.
in your system. How do you generate all the appropriate, kind of child rows, if you will? Like if I'm going to go in and add Jan Diana,
Right.
and your address, how do I add all of the other records so that it maps back to you?
I see.
Right, so that it builds your medical profile, but it's completely fake.
Right.
Right. So sometimes it does get a little more complicated to do, but yes, it's all fake,
Okay.
Okay.
completely fake from the beginning. And there are some healthcare companies out there. We talked to a few prospects that essentially they have contractual obligations or contractual restrictions that don't allow them to actually use the real data as a basis for anything. So the only way they can do development and testing for that particular client, because of their contracts, is to generate it all from scratch.
Got it.
Oh, wow.
Okay.
Yeah, so they can't use a de-identification solution, which uses the original data as a basis for generating the new data,
Right.
which is a lot what happens with a lot of these de-identification tools. They look at the original data, and then they do some calculations to figure out what the mass data should be. And that way you can always maintain consistency, right? Because that's the other thing we haven't really talked about, is you want to make sure that the name Jan Diana gets changed to, let's say, Mickey Mouse, right? Everywhere the same way.
Right.
Because you can't have it show up one place as Mickey Mouse and the other place is Donald Duck, because now all of a sudden that doesn't match.
Correct.
Right? And now your reports are off.
I see. And that also is kind of an identifier of mass data, essentially, right? So then somebody that's looking for that data can now be like, oh, this is the pattern here. That makes sense.
Right.
Okay. That makes sense. So actually, when it comes to HIPAA compliant data handling, what tools can help with data masking and de-identification?
That's an excellent question. And there's a lot that are out there today.